So this is a fantastic question. So this commenter is asking about what the recovery is like for revision surgery. So revision surgery is a completely different animal compared to primary surgery. And so when you've had surgery in the area before, things heal more slowly and more unpredictably. So in general, the normal post-op things are pretty much the same. So you typically have pain for a few days to a week after surgery that may or may not be managed with prescription medications. Your surgeon is going to monitor your activity and make sure that you don't overdo it and exercise too early. Both primary and revision surgery patients typically can exercise normally at about 4 to 6 weeks after surgery. The difference is when you look at your healing for primary versus revisions is that all of the settling and healing for revision surgery is going to take longer, and typically your risk of certain complications is going to be higher. So in general, the things that my patients notice the most is the settling of the breast takes longer in a revision surgery. And this is typically because you're usually making more of a raw surface area that's healing. So there's more of an area of scar that needs to mature and soften to allow settling of your breast in the implant. So that's really the big thing that patients see that bothers them the most with revision versus their primary surgery. Another thing that's common is that your scar may look different. So just because you scarred beautifully for your primary surgery, that doesn't always mean it will for the secondary surgery. And there's a few reasons for this. Often with secondary surgery, we're doing a lot more. And so there's a lot more pulling and tension on that incision when we're working. And sometimes we need to make bigger scars in different shapes, like you have to add a breast lift sometimes in revisions. And so you're healing more things and the potential for having abnormal scarring is higher. But in general, if you just give things a little more time, you will get there. So patients that have revision surgery, their scars will look great, their breasts will settle, their implants will settle. It just might take 6 months to a year longer than it would for a primary patient. So I hope that answers your question. If there's anything in particular that I missed that you'd like to know, let me know in the comments.